last year, I found out I was pregnant, and everything seemed to be going really well. Baby was healthy. Pre-pregnancy, I would get migraines, but it wasn't anything abnormal for me. Throughout pregnancy, I've never experienced pain like that. There's migraines, and then there were the headaches I was getting.
She got the migraines, the showers in the dark for, what felt like an hour. Just kind of thought that was normal. I mean, she said she's been dealing with it what seemed like her whole life, so we just kept trucking along.
When I was 18 weeks pregnant, I went in just for an appointment because we had some abnormal test results for the baby. Went to do my vitals, and my blood pressure was like, I think the first one was 180s over 100 something. And then every time they took it, it just get higher and higher and higher.
The day that I met Claire, it happened to be one of my hospital rotation days. And I got a consultation for her. And the reason for the consultation was hypertension. There are a couple of things that really stood out about her. The first is just the severity of the hypertension. Combining the lack of risk factors and the severity of the hypertension made me suspect that there might be what we call a secondary hypertension. So I did a number of tests on her, and sure enough, my suspicions for a secondary hypertension came true.
They ended up finding a tumor on my adrenal gland above my right kidney called a pheochromocytoma, which is a really rare adrenal tumor that causes your hormones to just go crazy.
This is one of those classic medical teaching things that are extraordinarily rare. They only happen in about 1 out of every 500,000 pregnancies. The current recommendations are to take out the tumor if you can earlier in pregnancy, because as Claire showed us, her blood pressure did not tolerate having that tumor on board.
Obviously, when you're dealing with surgery during pregnancy, that's going to make the surgery more risky for both mother and for baby.
I remember my husband coming in and being like, okay, what are we working with? And we sat and we had the conversation that nobody ever wants to have. Like, who do you choose? Do you choose me? Do you choose the baby?
That's when I, personally started freaking out a little bit. Once we learned about the risk and everything, we're looking at how real this surgery is and how dangerous it potentially could be.
So I was like, all right, let's do it. We obviously have to do its best. Everything went flawlessly, all things considered. I was hospitalized 7 times from July all the way up until our son was born. By 33 weeks, they told me, guess what? You're gonna have a baby this week. And we knew that baby would come early, but we just weren't sure how early.
She wanted me to look, see the gender, and then tell her. And so I was kind of like, they're like, all right, Dad, stand up. And so I'm like, oh my gosh. And then I stand up, and I didn't expect him to be right there on the other side of the tarp. So it's just like, it's a boy. Oh my gosh, I can't even think straight.
And so we had a perfect 3-pound, 5-ounce baby boy screaming from the very moment he was born. I think that was the moment that we both finally felt relief for the first time in months that he was okay. I'm very fortunate that my doctors worked with me very, very well and listened to me. Advocate for yourself is my number one thing. It's, I think, truly what saved my life is that I knew something was wrong multiple times.
A lot of times when we think about cardiovascular disease, its presentations, its manifestations, a lot of the things that we learned in medicine are all about how these things manifest in men. And so Go Red has really helped us to really emphasize that there are differences between men and women when it comes to heart disease in terms of their presentation, in terms of prevalence, so that we can become more aware of these differences, and therefore we are less likely to miss these things.
That's what my job is, that's what my career is, that's what my wish is to improve my patients' lives. I love looking at every patient that I see as a puzzle. How can I help this person? And the American Heart Association really helps me do that, educating them, reaching out to them, providing research to help this particular problem. It's a win-win for me.
The crying really just kind of made the day, it went from scary to best day ever.
He has been such a fighter through this whole thing. He is such a trooper, happy as can be.